Life is very busy for me. I'm a single mom. I work full-time, and I'm a part-time master's student. I'm also helping my mom. I'm a caregiver for her. On top of all that, I also have to manage my type 2 diabetes. But when you're on the go, the big challenge is nutrition. That's what it boils down to, foods that I eat.
For people with chronic disease, such as type 2 diabetes, if we don't help them potentially improve the way they live their lives, it's hard to help take better care of people. And that's one thing that standard modern healthcare is not good at. I'm inspired by the concept of a country doctor who can go to the family and help take care of them. That is a level of intimacy with patients that I think modern medicine has gone away from.
Hello.
Hey, Nini. Good to see you. The way I think Verily is really going to help us is by being in your pocket, by being available to you all the time. The way this AI assistant works is that you can basically have a conversation with it. What we're building is a platform that takes all those different types of data that we can collect from people at home and use that to help make decisions about their care. We want you to be able to just do that step-by-step thing to get to better metabolic health. And by making the data more decision-ready, we actually can make AI more effective for these patients.
It addresses a lot of questions I have.
Yeah.
What patients want more than anything is to be seen and to be understood and to feel taken care of. Now we are able to meet them where they're at with the stress of their life, with the barriers that they have to healthcare, and intervene at the moments that matter.
Using the AI coach was really helpful. It was nice to have an app that had answers to questions and suggestions and tips for my particular medical situation.
One of the great things about what we're building is patients can see how their data can improve their health. So that is incredibly empowering.
The fact that you could take a picture of your meal and get nutritional information from it is really great, because you might think something that you're about to eat is really healthy and maybe it's really not. It's just giving you that knowledge that you can arm yourself with to make better choices.
With this tremendous opportunity in technology also comes a large responsibility. And that responsibility is to both protect the data and the trust that our patients put in us.
In our products, and it's an ecosystem of AI agents. When we start working and we're building these systems, we're ensuring that security and privacy is built in. That's what we think about first. It's almost like a fortress. So when you give us the data, it's not leaving the fortress. How it can be used reliably, safely. Honestly, I'm excited about the technology.
When I was in the clinic providing obesity care, I had everything available to me, but I only had 15 minutes to visit with patients. The power of technology is the ability for that same care team to be with people every single day.
I did ask questions pertaining to getting in shape and bettering overall health. The app offered a certain amount of steps that I could take every day to see results.
With the advent of some new treatments, anti-obesity medications, GLPs in particular, for the first time in decades, we're possibly seeing a slowing of the rise of obesity. And by using AI, we can find which patients will most benefit and direct the care to them.
For me, what appeals to me about taking a GLP-1 is that not only would it help manage my blood sugar, but it can also help with weight loss. So that right there is just like, it's a no-brainer.
I know some people talk about how good technology recedes into the background. What that can do for us as physicians is it can allow us to be physicians again. Instead of treating the medical record, we can treat our patients.
I could not be more excited about AI as a tool to help people manage care between visits, mostly because AI allows providers to be so much more informed of what's going on with their patients, so that when it is time to make that key connection around behavior change, they have all the information ready to go.
It's just great to have an app that is personalized to your personal situation, to be able to look at the day and see if you could have made better choices. Because, and just trying to be healthy for my son.